Well, good afternoon and welcome to Cut to the Chase with Senator Chase. This is my weekly call-in town hall and radio show. That's right. This is a call-in town hall with your state representative, so feel free to call in today. The number is 804-454-1366, 804-454-1366. You can ask your question right here, right now on the air, so give us a call. In case you missed it, I'm State Senator Amanda Chase. I'm your weekly radio show host. I serve you at the state level, not to be confused with the federal level, which meets in D.C., and my office is actually at the state capitol in downtown Richmond, and I enjoy having people to come to my office in and out of session. And I actually represent the 11th Senatorial District, and that includes all of Amelia, all of Colonial Heights, and most of Chesterfield, which is actually where I live, where I grew up. I co-founded the Transparency Caucus, which has worked in a bipartisan, bicameral way to ensure committee meetings are streamed and recorded to give constituents greater access to the actual work of the legislature. And for the first time in Virginia's legislative history, this past session, Legislative Services has provided to you this service. It's you can go to virginiageneralassembly.gov, and you can actually, if you get really bored or can't sleep at night, you can go back to that website and you can actually watch reruns. That's right. And so that should be fun. Well, if you have a question about today's topic, I invite you to call in. Again, the number is 804-454-1366, and I will do our best to answer your question on the show. Now, as many of you have heard in the media and the news, we met this past Wednesday for special session. And there's been a lot of talk about, basically we had to put some procedural things in place to get things started again because we closed out the last session and we're basically starting up again. And our hope was to pass a clean budget without Medicaid. But unfortunately, that did not happen in the House today. We will go back this coming Wednesday, next Wednesday, and we will be back for reconvene, in which we try to override governor vetoes, which there weren't as many as last year, thankfully. And I'll be telling you about, I think I've got 12 bills that the governor is going to sign. I'm pretty excited about that. And we're going to talk a lot about Medicaid expansion today because of all that's happened, and really that was the center focus of what is going on in your state legislature right now. And those of you who are tuning in, you may not be political, and you're thinking, why do I really care whether we expand Medicaid or not? Let me tell you why you want to care. I grew up in Chesterfield County. My husband did as well. We've raised our family, our 4 kids here. We have 2 small businesses here in Chesterfield County, and I'm very concerned that this is going to bust our budget. A lot of people have said, we only have to pay 10%. Well, if I go and buy a mansion that's out of my price range, even 10% is way too much, which is what the problem is right now, quite honestly. We can't even afford the 10%. And so I'm going to break that down for you because I'm very concerned about us taxpayers. We're going to, what typically happens anytime we expand Medicaid in other states that have expanded, you're going to look at their bond rating going down, not up. And I'll go through all that later. You're looking at more people signing up than what they thought. You're looking at the cost per person skyrocketing. And not only that, but the administrative cost. You have to take it, think about this. The system, the whole IT system that Medicaid is set up on is going to have to completely change, especially if they put that work requirement in there that the House is proposing. So I'm very concerned. The bottom line here is that you need to call your representatives this week, and you need to tell them to stand firm, do not expand Medicaid. And there are some people who are convinced that this is a good thing for Virginia. And, it reminds me of whenever I take my 4 kids and we go to Walmart, and there are all kinds of things they see in Walmart that they want to buy. Let me tell you, it's why I don't do this very often. Because, you want to give people things. I mean, we want to be givers. That's our human nature. We want to give to other people. And the problem is that the bill comes at the back end There is a take care of people's health care. There is a difference between health insurance and health care. And so we've talked about that on the show. So as you know, the General Assembly returned to Richmond this week to begin the process of completing the work on Virginia's two-year 2018-2020 budget. Now, let's talk about the differences here, because there's still great differences between the spending plans posed by the House and the Senate on and they're still there from what they were in regular session, which just concluded over a month ago. First of all, there's still more than $3 billion, that's right, with a B, in revenues separating the two proposals. The second thing is that the House's plan still includes Obamacare's optional Medicaid expansion. There is a new tax thing for that tax. Raise your hand, because if you go in the hospital, it's going to be you. I call it the bed tax, as many other people do. And not only that, but the House's plan is entirely unrelated to health care, which that just blows my mind. I mean, if you're going to take the Medicaid money, the 9-to-1 match, at least spend it on health care. That's not what they're spending it on. When the House is talking about expanding Medicaid, it's not a pure Medicaid. They want the work requirements. They want to take that money from the federal government and they want to spend it on everything else in the budget except for health care. That's really tough. So much of the news coverage related to the continuing budget impasse has predictably focused on the politics of the differences, right? And just to recap for you, we had a minority of House Republicans, I think there were 19, joined with every House Democrat, and they approved a budget that would fully implement Obamacare in Virginia. And this, I'm talking about last month, I'm not talking about this past week. While every Republican senator, myself included, along with 4 Democrat senators, I might add, voted to approve a budget based on existing revenues without expanding Medicaid. A clean budget. That's really what we want. And I don't think it's too late for that. I'm still very hopeful, and we'll talk about that. Although there are many differences between the House and the Senate approaches to spending your tax dollars over the next 2 years, the implications of those differences on the people of Virginia has not received the same level of scrutiny. And in fact, reducing the differences to Obamacare or Medicaid expansion accurately pinpoints the key to the current disagreement. So let's talk about, what does Medicaid expansion really mean? Because I think a lot of people are talking about a lot of different things. So let's make sure we're talking about the same thing. When you read about Medicaid expansion, the policy is referring to an optional feature of Obamacare that would give Medicaid benefits to able-bodied adults who are currently not eligible for the program. And I just want to remind you that the primary reason, really the only reason whenever Medicaid was first created, was that it was to be a safety net for people who don't work. It wasn't supposed to be insurance. This is to help people who can't work. It just blows my mind that we are taking a program to design the very truly needy, the people who can't work, and that we're putting a work requirement on it. It blows my mind. So if this policy were to be enacted, it would not increase benefits for any of the $1.3 million that of 1.3 million Virginians currently covered by Medicaid. Medicaid currently reimburses hospitals, healthcare providers, and physicians who accept Medicaid patients, but only for a portion of the expense of providing care to around 650,000 children in low-income families. And then there are about 360,000 who are the caregivers or the parents of those children, and that also includes pregnant women. It also covers around 260,000 individuals with disabilities and 80,000 elderly patients. What Medicaid expansion would do is increase by about 30% program. Now, as we mentioned before, Virginia's taxpayers would be required to pay 10% of the expense for these additional patients by 2020. In addition to paying for that, They're also going to have to bear the expense of the administrative cost related to any requirements it placed on eligibility. And President Trump's proposed budget phases out funding for Medicaid expansion, meaning that the 10% expense could become a lot higher very soon. So I'm very concerned about that. We're going to go to a break, but I want you to come back and we're going to talk about Medicaid expansion. So stay tuned. We'll be right back.
Lately, I've been losing sleep.
Well, welcome back to Cut to the Chase with Senator Chase. This is our weekly call-in town hall and radio show. I invite you to call in, ask me any question you like. Today we're talking about Medicaid expansion. The number is 804-454-1366. 804-454-1366. I'm State Senator Amanda Chase. I'm your weekly radio show host, and I also serve you in the state Senate. And we are back in reconvene, and I guess it's a special session. Reconvene is actually next Wednesday, and I basically I'll be given 48 hours notice when I have to go back in, and I will definitely have to go back in on Wednesday to try to override veto. So we'll be meeting again Wednesday, but we have this huge impasse right now, and for those of you who are following what's going on with the state budget, we have a drop dead deadline of June. We have to get this done so that we can have a budget by July 1. Very important. So these House bills basically today they went before the House Appropriations Committee, and that's where we have to start this bill. And today's vote by the House Appropriations Committee is an essential step in advancing the process of resolving the current budget impasse. So we have to do this. And while we would have preferred the committee introduce a clean budget, which means that there would be no Medicaid expansion in it, their actions are consistent with what Chairman Jones has communicated to us, that basically it's going to have Medicaid in it. Now, there were a few changes to the House's original proposal that was approved by the committee today, and they do not do anything to narrow the chasm between the House and the Senate budgets. And I continue to believe that the General Assembly is working to craft a budget with incomplete information. And I agree with Senator Norman on that. That's exactly what's going on. Senator Norman issued a statement today, and he said an up-to-date and comprehensive revenue forecast would greatly assist the General Assembly in its efforts to reach an agreement on a fiscally responsible budget based on sustainable revenues. Now, what is he talking about? Next month, we're supposed to get an up-to-date comprehensive revenue forecast based on taxes that are coming in, what our revenues look like. He says our disagreements with the House's plan are unchanged. Their proposal to add work requirements in exchange for extending Medicaid benefits to able-bodied adults does not include the funding necessary to implement, administer, or enforce its provisions. That the House plan includes this provision while not requiring it be enacted and effective before expanding Medicaid makes their plan straight Medicaid expansion for all practical purposes. The taxpayer safety switch they have touted as a reform is unrealistic and was included in all of former Governor McAuliffe's expansion proposals. I have Jonas, who has a Medicaid question, who lives in Richmond. Jonas, thanks for calling in. All right, Jonas.
Hello?
Jonas, it's Senator Chase. How are you?
I'm very well, thank you. It's actually Joseph.
Joseph. Okay, I'm looking at my call screen here. So it's Joseph. We misspelled your name. I apologize. Joseph, what question can I hopefully answer for you today?
So I live in Richmond. By and large, I'm a begrudging Democrat, but I enjoy listening to this radio show because it gives me a different perspective. I find it to be a healthy behavior.
I appreciate that.
Absolutely, absolutely. So I guess just my biggest question is, I mean, obviously you're by and large against expanding Medicaid Can you, and this isn't an issue I haven't followed phenomenally closely. I've followed it, of what I've heard on the radio. Can you kind of give me the primary argument that the people have that are for Medicaid expansion, why they want to go ahead and expand it, and why that argument, just doesn't hold up?
Joseph, I think that is a great question. And the arguments that I'm hearing, and first of all, I just want to compliment Joseph just for wanting to know more. And I think it's great to challenge yourself. I do the same thing, by the way, with my Democratic colleagues, because I think it's good to learn other people's perspectives. And I'm also on Facebook as well, and people like to make comments on there. And I really appreciate the tone in which you want to learn more. And so here's what I would tell you, Joseph. One of the biggest things that I hear is people say, well, there's 400,000 people that currently need that health care. And so we should provide them, because basically the federal government's going to provide 90% of the cost, and Virginia only has to come up with 10%. Mm-hmm. That is one of the arguments. And so it sounds really good, 90 to 10, but the only problem, well, there's several problems with that. And one of those being that Mick Mulvaney, I guess it's been a couple weeks ago, it's back when we were in session, came out and basically said the states, and I can try to find the quote here for you, but he's basically saying that the states that have expanded Medicaid at this point have several challenges. One being the number of people that have actually signed up and enrolled in Medicaid is far more than they forecasted, for one. And the second problem has been that the cost per person, meaning how much the medical expenses per person, is just skyrocketed. It's great per person. And so what he's saying, and I do remember him using the words unsustainable. This is unsustainable at any level. So that is one of the biggest arguments that I have heard as it comes to, why should we expand Medicaid? It's just, they're looking at it as, we're getting, the federal government is basically going to fund this, is what they're saying. But the
Right.
challenging part of it is that Virginia has to, and if you break this down into an amount, the 10%, it's $300 million. Virginia has to identify over $300 million to cover its portion of fully implementing Obamacare by expanding Medicaid. And the House's proposal does this with a new tax on hospitals. But that tax is not likely going to cover the growth of the expense of the program, which averaged nearly 9% annually over the last decade. And under its current provisions, spending on Medicaid accounts for 23% of the state's general fund. And believe it or not, back in 2007, it was only at 14%. So okay. The challenge for me, Joseph, is that, we at the state have to balance our budget. At the federal level, they simply just raise the debt ceiling and, I'm
glad you brought that up, because I was actually going to mention the $1.4 trillion tax cut.
Right, yeah.
That, of course, I disagreed with, but go on, I'm sorry.
Yeah, no. So, my concern, we talk a lot about, we want to be compassionate for people. We want to be compassionate. I mean, there are a lot of people that are hurting out there that are disabled, have intellectual disabilities, and I advocate for them on something they're called Priority 1 waivers. And there's about 3,000 of them in Virginia. It's a current existing program that Virginia has. And we have 3,000 people on it. And even after the House and after the governor expanded, put a Medicaid expansion in the budget, and they put the hospital tax in the budget, they did not honor the people that we already have an obligation to help regarding health care.
That are already on Medicaid.
Yes, and that just blows my mind. In fact, they only put enough funding in there for 825 people, and the rest of the money, do you know where they spent it? Everywhere but health care.
Okay.
Everywhere but health care. So Joseph, I just, I can't get my head around that. I think we should, if we're truly going to say we're going to help people and provide health care for those people who can't help it, I think we should do that with the priority one waivers, where it's a 1-to-1 instead of a 1-to-9 ratio, where in other words, the state, for every dollar the state gives, the federal government's giving $1 to the regular Medicaid program. Mm-hmm. When we talk about enhanced or expanding, we're talking about non-federal dollars to every one state dollar. Joseph, we are going to a break right now. If you have any further questions, you're welcome to stay on the line, but we'll be back in like 4 minutes. But I really appreciate the phone call. Thanks for calling in.
Well, I appreciate you taking it. Thank you very much.
Thank you. Stay tuned. We'll be right back. You're tuning in to Cut to the Chase with Senator Chase, our weekly call-in town hall and radio show. Call in. Give us a call. Happy to answer your question. 804-454-1366. 804-454-1366. Just happen to be a state senator and here at your service, and I'm here to answer your questions. We have another Joseph who's calling in this time from North Chesterfield. So, Joseph, are you there?
Yeah, can you hear me?
I can hear you very well. Thanks for calling in.
Hey, last week I thought you were saying that the Senate was going to hold together pretty well and resist this expansion, but during the week I heard on the news that a couple of Republican senators have changed their minds and are now going to vote to expand that. Can you speak to that?
I am so glad you asked me that question because let me tell you what has happened this week. So what you're referencing, Senator Wagner came out in a editorial piece in Virginia Beach and made the statement that he had some suggestions for commercial insurance and was open to some ideas in expanding Medicaid. And then we also heard Senator Hanger. He also said that there would be certain conditions. Now, he's not for a hospital tax. He's also not for the House's budget, which takes the 9-to-1 money that we get from the federal government if we were to expand Medicaid. He's not for sprinkling that through everything else but healthcare. He's like, if we're going to take the 9-to-1 money, then let's spend it on healthcare. Not teacher wages and all these other things. And I love teachers and I love giving them raises. And I have actually advocated for one last year and we got it. But I think it's disingenuous. If you take the federal monies for healthcare, you should spend it on that. But here's the challenging part and why I think we still have a shot at this. All the senators have pledged to each other and to our leadership that the 21 of us will not back Medicaid expansion. And so we have a couple of senators, as you mentioned, Senator Hanger and Senator Wagner this week, who have introduced a way in which they would support Medicaid. But the challenge is it's kind of like a puzzle. What they want to do does not align with what, number one, the governor wants to do, the House wants to do, and what each other wants to do. So the puzzle pieces are not going to fit so that they get a compromise. So I am still optimistic that we will be able to hold the 21. I don't know what they're going back and telling their district. I mean, maybe, in Virginia Beach, I know it's a little bit different than here in Chesterfield where I grew up. But, I know what they agree and disagree on, and they're actually opposite of each other. They're in other words, there's no way that Senator Hanger and Senator Wagner, it does not appear that they are agreeing on the same types of things. So therefore, they're still at a stalemate, if that makes sense. It's, that the House and the governor like chocolate ice cream, and Frank Wagner wants vanilla, and Hanger wants tutti frutti, I guess. So we're still at a budget impasse. My producer's laughing at me over here. But that's the super simple version of it. But Joseph, I appreciate the call. And do you have any other questions?
Well, so then the news reports were kind of simplistic is the way to look at that, I guess.
Yeah, I think they're always looking for a story. If we look at the history of the state Senate, I mean, typically the state Senate has been more moderate before I got there and before I came in with a freshman class of 8 people. what a lot of people don't realize is that whenever my freshman class came in, we changed, 30% of the state Senate, which is huge. The Republicans that were replaced were more conservative than the Republicans that were there that tended to be more moderate. And for the first time ever, our Republican caucus is unified. I mean, we used to have the conservatives fighting the moderates, and they had their own separate caucuses. It's not that way anymore. We actually all caucus together for the first time in maybe centuries. I don't know. So I am still hopeful. I mean, we had a caucus meeting before we went into session on Wednesday, and I'm not allowed to talk about my caucus meetings because I do respect the leadership in that. But I will tell you what I said in that meeting is that if senators deviate and they don't keep their word and they don't keep their promise, there should be consequences for their actions. They should lose chairmanships. They should lose. I know Senator Wagner sits on as the chairman of Commerce and Labor. If I were the majority leader, I would take the chairmanship away. I would do that. I feel like people are so frustrated with the Republican Party because we elect politicians in there, and I hate to say it, but you all are very skeptical of us, but we deserve it. Not me, because I stick to my principles. But whenever
I don't understand the politics. It seems like the Republicans got a shellacking last November, and instead of holding firm, they seem to be giving us less reason to support them.
You're exactly right. And let me tell you, I let them have it in caucus. I told them that, that this is why people don't trust us. We have a Republican creed that says limited government. Medicaid expansion is expanding the size of government. And we can argue all day and all night about this and that and the other, but it comes down to a very simple thing. You either run on something and stand for it, or you lie. And you're disingenuous. And I think you should be kicked out of the Republican Party, quite honestly. Maybe we should start doing that. If Republican legislators don't hold to those Republican principles, we just kick them out. I don't know. Anyway, Joseph, thank you so much for the phone call. I appreciate you calling in.
Thanks for the information.
Thank you. All right. Are we going to a break here? I think I heard the music. Okay, great. So we'll be right back. Stay tuned. To cut to the chase with Senator Chase, our weekly call-in town hall and radio show. The number here again is 804-454-1366, 804-454-1366. I don't know about you, but I'm fed up with politicians that run on one platform, and when things get tough, what do? They don't have a backbone. If we Republicans who are in elected office don't continue to represent the Republican creed, we need to change our mascot from an elephant to a jellyfish because it has no backbone either. All right, Dave Hoopsick, I think, is on the line here from Colonial Heights.
Yes, I'll tell you, Senator, I get more proud to have you as my senator every time I listen to you.
Well, thank you. I appreciate hearing that. I hear a lot of people who are not happy out there who don't. My frustration has been this. A lot of people are saying, I'm on my Facebook page, and I know you've probably seen that today because I've been very active on there lately. People who are, good-hearted people who are saying, look, let's expand Medicaid. Let's get that money, the federal dollars or whatever. And I just feel like it's my job to educate people. I spend an awful lot of time researching this, looking at statistics, to get it right. It's a big decision. So tell us, what is your question today, Dave?
I will tell you on the thing about kicking them out of the Republican Party. I'm all for it. I actually rode with my delegate, door knocking with him, and he promised me he would not vote for the expansion, and now he is. But the question I had is, do you know of anywhere where the work requirement actually worked? Because everywhere I've seen that is just a scare tactic that gets people not to either sign up or get them off temporarily. But
yeah,
anyway.
there are actually all kinds of issues with that work requirement. And, the first one that I would say is what I've always said is that if you're putting a work requirement on this, you're missing the whole point of what Medicaid was intended to be, which was a safety net for people who can't work. So, that part concerns me already. But if you look at states, like I know that one other radio show host touts Indiana, and if it's good enough for Mike Pence, it's good enough for me. Well, you know what happened is Mike Pence never supported Medicaid. He was given Medicaid. The governor before him expanded Medicaid, and he went in and saw how it was killing their budget and went in and actually added the work requirements to try to get people off of there because they couldn't afford it. It is unsustainable, and I think I'm going to say that the rest of the rest of the time we're on the air today. Medicaid expansion is unsustainable.
I agree, and really the second part of that question is the. Do you know of any government programs where the safety net actually worked and they actually stopped the program because they ran out of money, so to speak, from the federal government?
I don't. I know we have TANF, which is the Temporary Assistance for Needy Families. In the 1990s, federal law called for the condition to be added to welfare. They added the work requirement. When Tennessee implemented TANF work requirements, the state spent more than $70 million, and that's according to the Sycamore Institute, which is a nonpartisan policy institute. I believe in New York City, the cost of just implementing job training programs for welfare recipients was about $17 million. But in most cases, states can get the feds to pick up part of the tab, and states can receive a federal match for new administrative costs, but most of the time it's 50%. It's just, states are going to be on the hook for big sums of money, and it's just not a good idea. And we were talking about Kentucky. Kentucky, the state has reportedly budgeted about $170 million to implement its waiver, and there's a lot of the thing that we're seeing is the need for money for the IT systems because they're having to upgrade the IT systems and develop it because you're adding something different. And so what they're saying is that that some people are going to start getting kicked, some are going to start kicking people off their insurance plan for months at a time if they fail to report a change in income, pay premiums, or submit paperwork that proves they're still eligible. States aren't just adding work requirements. They're creating a system that will track employment, premium payments, and other metrics that will all be significant modifications. Now, there are 4 states that are also proposing a time limit for how long people can receive Medicaid. So, there's all kinds of different formulas, and it's, they're not talking about all these additional expenses that the state is going to have to incur, IT-wise and otherwise, millions of dollars. That the federal government has said that they're not going to pay for. So that's the challenge there. So there are 2 big costs that come with implementing these kinds of changes, according to the experts. There's the IT side, which is updating systems that house beneficiary data, in some cases creating entirely new ones. And then there's the personnel side, hiring more staff to track compliance and appeals, and then training existing staff on the new requirements. So I hope that answers your question.
Yes, thank you very much. And as I said, keep up a good fight, and I am proud that you are my senator.
Thank you, Dave. I appreciate that. And now I have Rod O. from Chesterfield. And Rod, are you there? Okay, let's see. Is Rod there? Okay. Rod, if you hear this, you feel free to call right back in. We've only got like 10 minutes left to the show here, and there are a couple of other things here. So Wednesday is we go back into reconvene, and so we'll have more information on that. I do want to give you, since we've only got like 10 minutes left, I'm very excited. I had about 11 bills to pass the House and the Senate and are going to be signed into law. One of those being Senate Bill 20. It's a regulatory reduction pilot program, and I'm excited about that. You know, about 40% of our regulation comes from two agencies that has to deal with licensing, and so that bill is passed. There's Senate Bill 701, and that benefits our Alzheimer's folks. It's a license plate. It's a special license plate for those of you who have loved ones with Alzheimer's Association. Senate Bill 702 has to do with helping our private preschool programs and licensure exemptions. Senate Bill 716 is a bill that's going to help our Virginia Department of State Police. It's a study that they're going to do to hopefully expedite those background checks that if you're, seeking employment or you're a teacher and it's taking a very long time, even months, to get your background check back, this is going to help that. Senate Bill 717 basically is a transparency bill which helps our agents to ensure if they do the work that they get paid. And then finally, Senate Bill 912 is for you who are in law enforcement out there and you're retired. And when you retire, you get to keep your card, your identification that allows you to carry a concealed handgun. And what's been happening is if they return to their employment as a law enforcement officer in an administrative capacity, then they can actually now, with this bill, they can actually continue to carry and not lose that privilege. It looks like I have some other callers to call in. Do we have Rod back on? Okay, no. All right. So we apologize. My producer said it was his fault. He's very sorry, but please call back. Okay, so those are the bills that I was the chief patron of, and those are going to be signed into law. But there's some other ones that I co-patron that I really like. Senate Bill 106 has to do with gerrymandering and trying to get rid of that. As you know, the congressional and state legislative districts are drawn, and there have been a lot of concerns about finger-like tendrils and making it's become a political type thing where politicians would draw themselves out of the district and crazy things like that. This is taking all that out of there, so I'm really happy about that. Senate Bill 264 is a Campaign Finance Disclosure Act, and it's adding electronic filing for local and constitutional officers. That's going to be signed. And then also Senate Bill 511 is to help our optometrists to be able to practice at the full rate in which they're able to use their schooling. So more optometrists are going to be happy about that. Gosh, 6:52 already. I guess we'll be right back. Stay tuned. Welcome back to Cut to the Chase with Senator Chase, and this is the final segment where I do my wrap-up for the week, and we've got a lot of people still calling in, and I wish I had more time to take all of your phone calls. I'm really excited to see the participation today. This is a hot issue and a hot topic, and I'm going to continue to talk about it. So I'm going to wrap up the phone calls, but I do want to summarize some of the things that we've talked about today. Just first of all, put on your calendar Wednesday, because Wednesday is when the General Assembly will be going back to Richmond to hopefully override some vetoes from the governor. And so you'll want to be paying attention to that. You can also, if you're at work and you want to tune in on Wednesday, guess what? You can go to virginiageneralassembly.gov right there at your desk, and you can tune in and watch the General Assembly in action and see what we're doing and what we're up to. So that's all very good. Just a reminder that I will be back on the air for a weekly town hall from 6 to 7, and I've been doing this for, a year and a half now. And I know, Josie, you are interested in a fair tax for states like Minnesota, and I'm going to do some more research on fair tax. I don't know that I'm prepared to talk about that today, but that is certainly another idea out there, and we'll do some more research on that. But right now, our focus that's before us and on the table before us in the General Assembly is Medicaid expansion. If you weren't able to get your call answered, go to my website, go to chaseforsenate.com and email me this week, district11@senate.virginia.gov. If you can't remember all that, you just look up Cut to the Chase with Senator Chase or Senator Chase. You can Google me. You can find me, I promise. And I will get your question, and I'll even read it on, if you want me to, I'm happy to read it on the air. So I want to talk about the last couple of bills that actually were approved by the House and the Senate, and the governor is going to sign into law. And one of those is Senate Bill 809, which has to do with eminent domain and calculating lost profits. So what happens is, if it's called a whole and a part take. So you can have one or the other. If the government wants to take your land because they're building a road or something, a partial take, pretty obvious if they take part of your land. They were only going to compensate you. They're going to give you 3 years worth of, if you're a business or a farm, they're going to give you 3 years worth of income. But if they take your whole property, guess what? They are only going to give you credit for 1 year. That just doesn't even make sense. 1 year's worth of revenues would you get reimbursed for. So we fixed that. So it's better now. So you get 3 years instead of the 1 year. We've also talked about coal ash, Senate Bill 708. I'm going to continue to work with Senator Servell and other members of the House who have also submitted coal ash bills. We're going to work together out of session. We are going to come back with proposals from the vendors who have recycling options for us that will hopefully offset the cost. I'm very concerned about the cost. I don't want this huge price tag passed on to the ratepayers and then have them expense it over 2 or 3 years to give us a bill that we don't want. I want to be able to expense this expense over a longer period of time. And then also Senate Bill 714, holding our local economic development authorities accountable. There's also a study that's being done on that as well to make sure that they're not overriding the will of the people, because the people who sit on these local economic development authorities, I'm sure they're great people, but they are not elected by you. And so we need to make sure that our local elected authorities are doing their part to approve their budgets and making sure that these local economic development, I can't say it, say it twice, local economic development authorities are doing what you want them to do and not encroaching on your rights. So anyway, that's all I have time for today. Tune in next Friday, 6 to 7 for Cut to the Chase with Senator Chase. Until then, have a great week.